but we have a lot to cover, so let's jump in. So, like I said, my name's Missy. I'm the lead counselor here at Living Well. And tonight, what we're going to be talking about is counseling and support groups, what they are, how to know if counseling is right for you, how to know if a support group is right for you, what it actually looks like when you get to those places and try to participate in those services, how to get involved in those services if that's something you're interested in, how to know between counseling and support group which one might be better for you than the other, and then any questions you guys have about those services in general, and then also how those services work here at Living Well. So, some quick basics, right? Counseling is available for patients, caregivers, and the bereaved, ages 5 and up. Some counseling agencies may work with children younger than that. Living Well's cutoff is 5. Counseling can be done in person in Warrenville, which is where I am, in our space in Geneva, or virtually, which we can do phone or video. And you do not need to be an NM patient to participate in counseling or any of the services at Living Well. For support groups, let me just say every picture of support groups, people are this close together. We do not sit this close together in our support groups at all. I don't know why they all look like that. So just rest assured, you're not touching knees with strangers in our support groups. Nobody's sitting this close together. But we have groups that are specific to cancer types, like our breast cancer specific support group, our gynecological cancer specific support group, some groups that are just specific to being a patient, some groups that are specific to being a caregiver, and some groups that are specific to grief or being bereaved. Groups like counseling are hosted here in person in Warrenville or our space in Geneva, or we do them virtually, video, or hybrid. And we'll talk a little bit more about hybrid as we get into the support groups. And again, like all of our services, you don't have to be an NM patient. Also, for all of the services here at Living Well, there's no charge for those services, and that includes counseling and support groups. We don't bill to your insurance, and there's no charge for those services. So let's start first talking a little bit about counseling. And so, a lot of times if I'm doing a consultation with a patient or with a couple, or people are asking, how would I know if counseling was right for me, or why would someone even go to counseling? There are lots of reasons somebody would go to counseling, but here are some of the big ones that we hear specifically here at Living Well, though I assume they're probably true across the board. So one is editing or censoring what you share with others. And I think this is a big one for our Living Well participants, because what I hear and see all of the time is I'm talking to the caregiver and they're understandably stressed and feeling overwhelmed and feeling very emotional, but they're not sharing that with the patient. And what I hear is they've got enough to worry about. I don't want them to worry about me. Right? Or the patient is saying to me about their loved ones, they're already worried enough. I don't want to scare them. I don't want to burden them with what I'm feeling, right? And that's the word I hear all the time is I don't want to burden my loved ones with what I'm feeling or with worrying about me. So if you find yourself worrying about being a burden to your loved ones or your caregiver or your patient, if you find you're editing or censoring what you're saying because in the most loving, functional relationships, we do have a tendency to protect each other. And sometimes that looks like censoring, right? I want to protect you from the stress and the anxiety that I'm feeling. And in doing so, I'm not talking to you about the stress and anxiety that I'm feeling, which means I'm not talking to anybody about it. Okay? Sometimes it's just not wanting to overwhelm friends and family if what you're feeling is really big. So I had a session today over the phone with someone who just started their treatment and all the feelings were just really big. They were too much for her to hold in, but she didn't want to overwhelm her loved ones and worry that she was freaking out or have them freak out. Counseling was a safe space for that. The other thing I hear as far as editing or censoring and why people sometimes do that is they don't want to be, you know, Stephanie who talks about her cancer all of the time. I don't think I have anyone in this group named Stephanie. I don't want to be picking on anybody. So when you're with friends and family or you're, talking with your colleagues, you don't want it to be a constant source of conversation. You want to hear about how they're doing or talk about everyday life or your life outside of cancer, because I think it can quickly start to feel like cancer is your whole life. And so counseling becomes a place where you can really focus on the cancer piece so that you don't need to do that so much in the other facets of your life. Another reason people come to counseling at Living Well and elsewhere is kind of getting the sense that you don't recognize yourself. And that can be physically or emotionally. We know certainly physically for patients, there's weight losses, there's weight gains, there's mastectomies and breast reconstructions, there's having a port, there's losing your hair. There's a lot that can change you physically, and it can be really disorienting. It can be really unnerving to look in the mirror and not recognize yourself anymore. And then that can happen emotionally too. That can look like feeling more down than you're used to feeling. It can like you don't recognize yourself. And that can be, physically, like I talked about, but also emotionally too, where you are more down than you're used to being, where you have a heightened sense of worry or you're feeling more anxious, where you notice that the way you interact with friends and family is different, or the way you feel in your relationships is different, or maybe you're getting feedback from friends and loved ones that you just don't seem like yourself. And counseling is a great place to sit with that, to process what those changes are and how they impact you. Feeling overwhelmed. I mean, I think every person who comes through Living Well's doors as a patient or a caregiver or someone who's grieving understands how being overwhelmed is part of the cancer experience. It is just a lot. It's a lot to process, and it's not just a lot to process up front, right? It it's a it's an ongoing experience. So there are peaks and valleys and ups and downs. And as soon as you feel like you've wrapped your arms around one part, there's another part right behind it. And it can just be really overwhelming to just be forever having to process those changes, to process the stress and anxiety of upcoming scans or not knowing how your treatment's going to feel. And then struggling with changes. We talked a little bit about physical and emotional changes, but cancer can change every facet of your life. And I don't know if you guys have heard the expression before that some things can't be fixed, they can only be carried. And I think counseling is a wonderful space for that, because the people who love us don't like it when we're suffering. They don't like it when we're hurting. And so their tendency is to try to fix it for us, which is sweet and well intentioned, but not always possible. And sometimes in their rush to fix things for us, it winds up being really minimizing. It winds up feeling kind of dismissive. It doesn't actually fix anything, and it can sometimes make us feel worse. And so counseling is a space to sit with those feelings without feeling the rush or the pressure or the ambush of fixing it or necessarily having a solution all of the time, and giving yourself, I always say, time, space, permission. Giving yourself time, space, permission to sit with those feelings, to figure out what they are, what they mean to you, and where to go with them. What happens when you actually get to counseling? So if you're thinking that maybe, the things that I talked about that would be beneficial for if someone was feeling those things, counseling would be beneficial for them. If you find yourself relating to that and you're thinking, okay, well, what actually happens? What does it look like when I get there? Well, it looks like this picture. That's me in my office here in Warrenville with another NM employee who posed for the picture. Though full disclosure, I don't sit in that chair. I sit in this chair, and you can sit in one of these chairs. But in the beginning of counseling, it's a lot of getting to know you, getting some background questions answered, some that are specific to you or your loved one's cancer diagnosis, and some that are more general. Um, I have a lot of folks who, when they come to counseling, are really anxious because it's an odd setup. I'm asking you to be really open and vulnerable and talk about personal things with a complete stranger. And sometimes folks are like, I don't know what to say or how to start. And so I always say, in the beginning, your counselor is going to do a little bit more of the driving. So in the beginning, I have paperwork that I need to complete, questions that I'm going to ask you. And so if you're nervous, if you're not sure how to start, know that I'm going to help get you there. We're going to be talking about your loved one's cancer diagnosis. I always ask two questions, lots of questions, but these two specifically, anytime someone's meeting with me for the first time. And one of them is, what made you decide to reach out for counseling? And the other is, what do I need to know about you, or what do you need to share with me in order for me to be best positioned to support you and understand how you look at the world? And so that may have to do with your childhood. That may have to do with your belief system. That may have to do with what's happened to you in the last few years. And so we'll go through all of that to the degree that you're comfortable. After that, we're going to talk about goals for counseling and how counseling will be structured. Counseling sessions are 50 minutes in length. That asterisk is there, unless we're talking about kids and teens. And sometimes kid and teens appointments, as you can imagine, tend to be a little shorter. It's a lot to ask an 8-year-old to sit for 50 minutes. But adult sessions are 50 minutes in length. And some folks have really specific goals where they're very anxious about cancer recurrence and they really want to work on that. Other folks are noticing that they're disengaged or they're really struggling with feelings of hurt with how their friends and family responded to their cancer diagnosis, and we're going to work on that. For other people, they just want to utilize counseling as an opportunity to process their cancer experience. And like we talked about, it's an ongoing experience. And so for a lot of those folks, they're using each session as a way to process where they are, to process what, if anything, has changed, and how this journey feels for them as they go. How often should we meet? That's really up to you, with some caveats here, which we're not able to meet with folks more often than once a week, although not everybody wants to meet that often. We're able to meet with folks a maximum of 20 times, and that's 20 times per individual. So if you and your spouse decide you both want individual counseling, it's not that you both get 10 sessions, you both get 20 sessions. The only exception to the 20 session cap is if people experience what we consider a status change. So if you work with a counselor at Living Well and you reach the end of your time in counseling, and then let's say 2 or 3 years later, you have a cancer recurrence, we would add additional sessions. If you're a caregiver and you're working with your counselor and you reach the end of your sessions, but your loved one passes away, we would be willing to add additional sessions in that case as well. Fortunately, that's not the case for most of our folks, so we keep them to that 20 session cap. Another way we talk about, how often we should meet and when does counseling really come to an end, it's not always 20 sessions. For some folks, they only need a handful of sessions, and that's just fine. One of the ways we ask that is, how would we know if you didn't need to come in as often or didn't need to come in at all anymore? What would that look like? And so, it's really the counselor's job to keep a pulse on that and to be paying attention to what you said your goals were for counseling, how it feels like it's progressing, and kind of paying attention meeting to meeting. I had this conversation with a client today who's been meeting with me every week, and it was time to talk about what would it look like to think about spacing this out a little bit. How would that feel for you? The last thing I want to say about, when we think about counseling in the session, right, is that as I tell clients, I consider myself the GPS unit, which is highly ironic because I have a terrible sense of direction. But in here, I kind of know what I'm doing as far as that goes. And so just like a GPS unit, it's not my job to decide where you want to be. That's your job. My job is to get that information from you, where it is that you'd like to be, and then guide you the best that I can. Tell you to turn around if I think you need it, to try a different course. And just like a GPS unit, you don't have to listen to anything I have to say. We've all ignored our Waze or our Google Maps because we don't want to go that way or we know a shortcut. That's your prerogative. My job every time we meet is to get a sense of where you are and recalculate, and figure out how to go from where you are to where you'd like to be. If you're hearing all of this and you're like, yeah, okay, this sounds like something I might benefit from or that my loved one might benefit from. I like how it sounds when I get there. How do I get connected with this? It's really easy. You can email us at counseling@livingwellcrc.org, which is a shared email address that all of the counselors check every day, multiple times a day. We typically respond within 48 business hours, sometimes much faster than that, sometimes within 30 minutes. And appointments can usually be scheduled within a week or two if you have some flexibility in your schedule. If you are really only available a certain day, a certain time, or you really need late evenings, it can take maybe 2 to 3 weeks, but usually we can accommodate appointment needs really quickly. The other way to get connected is to call either of the Living Well locations. I've got the numbers on there. If you're a Northwestern patient, you can use either of those methods, or you can let your oncology social worker know that you'd like to be connected with the counselor. We get those referrals all day long. And so you would let your social worker know, and they would email us asking us to contact this patient, and then we'd reach out to you. A few other important notes, the difference between a consultation and counseling. So tonight I've been talking about counseling. There's always the option for a consultation too, which is kind of like a one-on-one or sometimes a two-on-one if it's a couple. Opportunity to talk with a counselor without the formality of it being an actual counseling appointment, to talk about what's going on, what you feel like you need, whether or not counseling would be beneficial, and what other Living Well services would be beneficial. For couples who are interested in counseling or families who think they want counseling as a family, we typically have them start with a consultation, because generally our guidance is individual counseling is better for Living Well's purposes. Being a patient is very different than being a caregiver. Even within bereaved families, the loss is different and hits different for everybody. And so it's really hard to manage all those conflicting needs and conflicting perspectives in one counseling appointment. And so most folks are better served by having their own individual therapist. But for couples or families who really think they want to be seen together, we'll have them start with a consultation and we'll talk that through. There is counseling paperwork that our clients fill out ahead of meeting with us. Once you're scheduling your appointment, we'll email that over to you. You fill it all in online and it gets sent to us automatically. It gives you a chance to tell us a little bit about what's going on with you ahead of the appointment. Also gives us a chance to ask some questions and kind of feel like we have a sense of what's going on with you before we meet. We do offer counseling for kids and teens. For kids and teens, that usually looks like the parent or guardian talking with one of our counselors for a little bit about what's going on, why they feel like this child or teen would benefit from counseling. The parent or guardian is usually a part of that first session and sometimes subsequent sessions, but usually not the whole session because it's important that the kid or teen feels like that's their space. Last note, if you're scheduling for a loved one, if that loved one is an adult, we need their verbal consent to make sure, not everybody in the world is signing their spouses up unknowingly for counseling. And so, if you're scheduling for a loved one, which happens all the time, I'll say, hey, can you put Tom on the phone? And they'll hand the phone to Tom and I'll say, Tom, just want to make sure that you're aware that your spouse is scheduling counseling for you and that you're comfortable with counseling being scheduled and with your spouse scheduling it for you. And if Tom says, yep, then I don't need to talk to Tom anymore until the session. I just need that verbal consent. Okay, so let's talk about support groups a little bit. So we currently have, I think it's 14 different adult support groups that are either facilitated by Living Well staff, which are the Living Well counselors, or Living Well trained volunteer. They are typically held in the evening. There are two exceptions that come to mind. One is the metastatic breast cancer group. The other is our virtual scanxiety group. Our virtual groups are 60 minutes in length. Our in-person groups are 90 minutes with the exception of our men's group, which is only 75 minutes. They are held virtually or in our dedicated support group rooms at both locations. Again, they're nice big rooms. You're not sitting this close to anybody else or touching their elbows or their knees. They're dedicated spaces, able to usually hold anywhere from 10 to 16 people, depending on how the room is set up. So right now we have groups that are virtual or in person, and also hybrid. So hybrid means that we're able to have the group meet in person, but also we have a hub, which is basically like a giant computer monitor where we're able to live stream the meeting. So folks from home can join the live in-person meeting. We can have them up on the cameras and they can interact with the participants who are attending live. Right now, the only group that we do that with is our gynecological cancer support group, but we're looking to expand that as we go further into the year. How many people are in a group? Really depends on the group, how the group meets, what the weather's like. There's a lot of factors that determine who's there any given evening. Our smaller groups can have 3 or 4 people. Our larger groups, like our men's group is a larger group, can have 10 to 12 people at any meeting. If you ask me what my perfect number is, my perfect number of folks at a meeting is between 6 to 8, because I think there's enough people that we're going to have a variety of different things to talk about, but not so many or so few people that it becomes daunting or that it feels like awkward for folks if it's a smaller group. So typically our support groups have anywhere between 4 to 12 people. There's no commitment required. So sometimes folks are interested in a support group, but they're like, well, but it meets, 4 Tuesdays a month, and I just don't know that I can do that. There is no requirement for that. So the majority of our people who come to support groups come in and out as their schedule allows or depending on how they feel. And so know that you are free to do that. You may, if the weather's terrible and you don't feel like driving out, that's a-okay, or if it's you come a lot during the summer when it's light out at night and you're more comfortable driving, and then in the winter you come less often, or you don't come when you don't feel good, you get to make it your own. So please don't feel like there's any commitment that's required. For scheduling counseling appointments, that has to be done through counseling staff. For support groups, you don't need to talk to one of us about that unless you really want to. You can register by calling either of the Living Well locations, or you can use our online registration system. Once you register as a participant, you can sign up for support groups, special presentations, yoga, art, any of our programs from there. So how do you know if a support group is right for you? Have any of the, I'm seeing your questions, have any of the counselors experienced cancer themselves? I'm not able to speak to anybody's health history, but I get that question a lot. The thinking being, how could they relate to me or talk to me if they've not been through it? And I think, while that's a fair question, if you think about counseling as a field in general, no counselor will be able to have experienced everything that their client has experienced. And that's maybe a good thing. If you're sitting in front of me and I've had breast cancer, which I've not, but for the purposes of this analogy, if I've had breast cancer and you have the exact same type of breast cancer that I had and you're getting the same treatment, it would be really easy for me to superimpose my cancer experience on top of yours. And instead of really being present and really listening to what it is like for Sue, I would be coming from my own experience the whole time. Right. And it would, for lack of a better word, pollute how I heard your experience. And so one of the counselors having cancer doesn't eliminate their ability to be effective, but it's not necessary for them to be effective. And sometimes it can be really beneficial if they've not had that experience. And so they can be really present with what it feels like for you. I will say I've done this work for what year is this? 15 years. And so while I may not know what it's like to have a gynecological cancer or a breast cancer, I've run those support groups and I've talked to hundreds, if not thousands, of participants. And so I have crowdsourced a lot of information and have a good general understanding of what people often feel in those situations. And I think, too, what's unique to the Living Well counselors is because we've worked so closely with the cancer centers and that this is our specialty. We know terms, like I know what the CA 125 is, and I know what it means when somebody says that they're doing like a head and neck radiation and what that means for them and how that will be for them on the table and that the mask gets bolted down. And so I'm able to contextualize a lot of the cancer experience differently than maybe a community counselor would, if that makes sense. So how to know if a support group is right for you? I think ultimately support groups are about connection. And so if you're really feeling like, I don't want to talk to a counselor who's not been through this, I want to specifically talk to somebody who's been through this because I want to compare notes, or I just feel really alone in this. A support group is maybe exactly what you're looking for. A lot of cancer is just such an isolating experience to begin with, and for a lot of folks, they feel, patients or caregivers or bereaved, they feel really alone in their experience. They either don't know anyone else they can talk to, or they don't want to talk to the people that are their options. And so, having a support group is the perfect space to come in and know that everybody is here to talk about it. Right? You have something in common with everybody in that room. They're either all patients, or they all have the same type of cancer as you, or they're all bereaved, or they're all caregivers. It's also an opportunity to connect with a community of support. So there are some great patient match organizations. American Cancer Society has one, Imerman Angels has one, and they'll match you with an individual, which is really valuable. But you may not always have a great chemistry or rapport with that person. It also really limits you to that one other person's experience. Whereas with the support group, even if they don't have the same type of cancer as you, you're going to hear from 4 or 5 people what it was like for them the night before their first chemo, or what it's like for them to be living with cancer as a chronic illness. And so everybody's going to have a little bit something different to offer there. If you're looking to hear a personal experience, so support groups, we talked about with counseling that need for our loved ones to want to fix. There may be some room for that in a support group. You may have something you really want people to speak to. If you want to compare notes, if you want to find out, has anybody had this where they have no appetite, or their loved one is having a really hard time sleeping, or you're just struggling to focus at work, or whatever that looks like. And so it may be helpful to be with other people who, cancer has a rough learning curve. And so people who are further ahead in the experience than you are, and being able to benefit from what they've learned the hard way. But it's also in some ways kind of like reading a memoir, where you're hearing somebody else share their experience. And as you're listening, you're identifying parts of your own story along the way, right? That's something resonates with you or that it validates something for you. I think so much of a support group is really feeling like your experience is validated or normalized at a time where nothing feels very normal. And then connecting with people who speak the language of cancer, caregiving, and grief. In some ways, I mean that quite literally. Spending all that time in doctor's offices, you're hearing terms and medicines that you probably never heard before, that you probably struggle to pronounce because none of it's easy to pronounce. And it's nice to be with a group of people who just know what those things are without you having to explain everything. I think the other way that I want to say that is without having to defend everything or justify everything. I've had folks say, and the FACT support group, which I run, this is the only place that I'm 100% honest, because they know they're not going to have to defend what they feel or justify what they feel or explain what they feel, because they're with a group of people who just get it, and they get to share openly and honestly and get a supportive response, or a shared or validating response, rather than somebody rushing in to try to fix it for them. So what happens in a support group? Again, you're not sitting this closely together, though we do wear name tags. If there's a new group member, we like to do introductions just to give that new group member a chance to get to know everybody else who's there, and everybody else who's there a chance to know that new group member. Beyond the introduction, there's really no expectation about how much or how little you participate. I think the introductions, what's minimally useful is your name, the type of cancer that you or your loved one was diagnosed with, and where they're at with their treatment. Other than that, if that's all you feel like sharing, that's just fine. Having run support groups for a long time, I found that there are some people who are really unsure about opening up to a literal or virtual room full of strangers, and so they say very little, and that's just fine. I've also met folks who are so relieved to finally talk to other people who get it, that they talk for a really long time. That's fine too. It's about where you're at and what feels comfortable for you. I had a group member say this so perfectly, that there are some times that you need the group and sometimes that the group needs you, meaning there are going to be nights where you come to group with something that you need to ask the group, that you need to unload, that you need to process, and the group is really there for you. There are going to be nights where that's somebody else, and they really benefit from you just being in that space and being supportive, even if you're being quietly supportive. Or you may find that you have something to offer or to contribute that helps somebody else. There are no set topics in our support groups. That asterisk is there unless somebody asks me for one. There have been a handful of times where people have asked me to come prepared with a particular article, or prepared to talk more about something that's been coming up, which we're glad to do. But I've learned over the years that nobody wants to talk about what I want to talk about most of the time. So I have abandoned any agenda. And what I look to the group to and say every time after we've done introductions is, what's the best use of our time today? Was there anything you came to group tonight really wanting to talk about, really wanting to ask the group that felt really pressed on your heart today? What's the best use of our time today? So between counseling and support groups, how do you know which one is better for you depending on where you're at? So I always say there are three types of people who attend support groups. One is someone who's just really looking to compare notes, who really just doesn't know anybody else who's had cancer or doesn't have anyone else they can talk to about cancer, and they're looking for that connection and that camaraderie, and they get that from the support group, and they don't really need anything else. Then there are people who are looking for that sense of camaraderie, that sense of connection, wanting to feel validated and to connect with other folks. But because it's a shared space and there's only so much time, it's not always appropriate to go more into the weeds about what's going on with you specifically, or there just may not be the time. And so for those folks, I say they're best served by going to the support group, but also participating in counseling as well. So they get the benefit of the group, but then they have their own space to process in a more deep way. And then there are folks, the counselors and I say, we've all met this person at least 2 or 3 times, who goes to the support group really looking for connection, really hoping that it will be helpful. But when it ends, they feel so heavy, and they go home thinking about all the other group members. They go home feeling overwhelmed by what everybody else is going through, and they just feel worse after. And for those folks, maybe a support group's not right for you. Maybe it's better for you to be in individual counseling where you get a chance to process what's going on with you without feeling like you have to absorb what's going on with everybody else. With that said, we always encourage people to give a support group 2 or 3 meetings before deciding whether or not it's right for you. Groups are living organisms and they change meeting to meeting depending on what's being discussed that night and who's there. And so if you're not sure about a group, try going 2 or 3 times before you rule it out. Same with counseling. You know, chemistry matters in all relationships, and counseling relationships are no different. And so we really want you to feel like you have a good rapport and chemistry with your therapist. And sometimes you need 1 to 2 meetings to really see if you have that. But also remember, you can let your counselor know what you're looking for and what you need. I absolutely have clients who are like, Missy, you got to give me stuff to read. I want stuff to read. Or Missy, I need homework. Or you got to give me something I can do when I leave this office today, which is really helpful to me. Everybody's different. Not everybody wants homework. Not everybody wants to spend their free time reading in between sessions. And so that's not my default setting. And I love when clients are really clear with me about what they need, and I can make sure they're getting what they need out of counseling. So let's run through some frequently asked questions. And if your question isn't in here, I'm going to hang around to answer some more questions. Do we offer couples and family counseling? I talked about this a little bit already. The short answer is yes, but we'll have you start with a consultation first. And I would say of all of the couples I meet with, I'm the only counselor who works with couples out of the Living Well therapist. Of all of the couples I meet with, I would say at the end of that consultation, 80% probably decide to go forward with individual counseling after we kind of talk about and realize as we're talking, you know, either you're editing or protecting your partner. And so you're not being really transparent in counseling, which is kind of counterproductive. Or you guys are having really different experiences, right? The patient is struggling with what it's like to be the patient. The caregiver is struggling with what it's like to be the caregiver. You'd really benefit from having your own space and your own time for that. Do all the counselors see all types of clients? Meaning, do we all work with patients, caregivers, or bereaved, or do we specialize? Yes, we're all equally skilled at working with bereaved, working with caregivers, working with patients. The only exception to that is that Cassie, who works out of Geneva, and Nancy, who works with me here in Warrenville, are our only therapists who work with kids and teens. I work with adults and couples. Beyond that, we'll all see anybody. The only other exception here is Nancy is our Spanish speaking therapist. So Nancy's our only counselor who's able to provide counseling in Spanish. Can participants request to work with one particular counselor? Absolutely. Sometimes that's because you've been in a program with us, you've attended this program tonight, or you've been in survivorship or attended one of our support groups, or, you know, like Nancy's self-image presentation, or sometimes it's because you know someone else who's worked with one of us and that feels more comfortable for you. So absolutely, you are welcome to request working with a specific counselor. Just let us know and we'll work with you to get you on their schedule. How often can you see your counselor? So we talked about this already. We can't do more often than once a week. Initially, I say it's helpful for us to meet once a week or every 2 weeks, at least through those first 2 to 3 appointments, as we're getting to know each other and as we're kind of getting a sense of what is the work we're going to be doing together. After that, I really look to you as the client to tell me what you want to do there. Do you want to continue meeting every week or two? Do you want to start eventually spacing that out to be a little bit less often? What's our cancellation policy? A lot of places have a 24-hour cancellation policy. And while we would love as much notice as you're able to give us, we understand that our participants are in kind of exceptional circumstances. And so, you know, how you feel as the patient or how your loved one feels if you're the caregiver, that can change over the course of an hour. And so it's not unusual for people to cancel on us last minute. We'd love as much notice as you're able to give us, but we're not going to penalize you if you're not feeling well or if your loved one's not feeling well. What we're able to do now that we're virtual, though, is if you're planning to come in person and you're just not feeling up to it, we can always change the appointment to be virtual so you can stay on your couch in your blanket and not have to leave the house. Can your loved one come to group with you? Your loved one can wait in our beautiful lobby while you're in group, but they can't join you in the meeting unless it's like our head and neck group or our brain tumor support group that does include patients and caregivers. Or you and your loved one are both caregivers to the patient, or you and your loved one are both bereaved, though I do generally encourage folks to really think about that. So if you and your, let's say, adult child are both caregivers for your spouse and you both want to go to the group, you are welcome to. But I'd ask you to really think about what it feels like for you to be sharing in group with that other person there. Some people find that to be really comforting to have their loved one there and it's beneficial to talk about it afterwards. That's great. I just encourage you to really think about it. But yes, if it is a patient only group, caregivers aren't allowed at all. If it's a caregiver only group, patients aren't allowed at all. Do we have support groups for kids or teens? Not at this time. We did pre-COVID, but obviously COVID changed everything. We're really hoping to see those programs begin again in 2024. So that's something that we're working on. Can I attend multiple different groups? Absolutely. We have a lot of people who come to like the men's group and FACT or the mastectomy group and the breast cancer group. So as long as both groups apply to you, you can absolutely attend more than one group, either regularly or to kind of feel out if one feels better for you than the other.